Welcome back to OMFS Essentials. Following our last episode on drains, we now turn to the final layer of wound management, dressings and bandages. It is critical to distinguish between these. A dressing is the material in direct contact with the wound designed to promote healing. A bandage is the material used to hold a dressing in place, provide support, or apply compression. Today, we'll cover the properties of an ideal dressing and the different types of dressings and bandages used in oromaxillofacial surgery. 1. The ideal wound dressing. A dressing is not just a simple cover. It's an active part of the healing process. An ideal dressing should maintain a moist environment. This is the most important property. A moist but not wet wound bed allows for faster epithelial cell migration. A dry wound forms an eschar, or scab, which blocks this migration. Providing protection. It must be a mechanical and bacterial barrier to protect the wound from infection. Be non-adherent. It should not stick to the wound, which would cause trauma and pain upon removal. Allowing exchange. It must allow for gaseous exchange, oxygen in, CO2 out, but be able to absorb excess wound exudate. Be safe. It must be non-toxic, non-allergenic, and sterile. 2. Types of conventional dressings. The type of dressing is chosen based on the wound's needs. A dry dressing, a simple dry gauze, used for clean, closed, postoperative sutured wounds. A wet dressing, gauze soaked in a solution like saline, betadine, or Usol, used for granulating ulcers. Glycerin mag sulf dressing. Mechanism. This is a hygroscopic dressing. Magnesium sulfate, MgSO4, is a salt that pulls fluid out of edematous tissue via osmosis. Use. Excellent for reducing edema in cases of cellulitis or severe post-surgical swelling. Vaseline gauze dressing. Mechanism. This is a classic non-adherent dressing. Use. Ideal for covering healthy, raw, granulating surfaces where you want to prevent the dressing from sticking, such as skin raft donor sites. Occlusive dressing. Mechanism. This is an air and watertight dressing, e.g. Vaseline gauze. Use. Used in first aid for sucking chest wounds, to prevent a tension pneumothorax, or to cover an intestinal evisceration. Biological dressings. Bioactive. These are advanced dressings that actively participate in the healing cascade. Amniotic membrane, AM. Source. The innermost layer of the human placenta. Properties. This is a remarkable material. It is non-immunogenic. It does not express HLA, A, B, C, or DR antigens, so it is not rejected. It is also anti-inflammatory, anti-fibrotic, and antimicrobial. Action. It provides a secure cover, reduces pain, and actively stimulates re-epithelialization and granulation by releasing growth factors. Collagen dressings. Properties. Biocompatible, non-immunogenic, and hypoallergenic. Action. Collagen acts as a biomaterial scaffold. It encourages wound healing by allowing fibroblasts to migrate in and by promoting the deposition of new granulation tissue and angiogenesis, or new blood vessel formation. It also helps control bleeding. Bandages. The purpose of a bandage is to cover, support, immobilize, or exert pressure. Simple roller bandage, the standard single or double-headed roll. Jaw support bandages. A barrel bandage, a method of wrapping a roller bandage to support the lower jaw. A four-tailed bandage, a piece of cloth with two tails on each end used to tie over the head and support the mandible. A mastoid bandage, a specific wrap used for compression after TMJ surgery. Compression bandage, creepy or elastoplast. Purpose. This is a key surgical bandage. Its purpose is to apply pressure to 1. Achieve hemostasis, stop diffuse oozing, 2. Obliterate tissue dead space, linking back to our drains episode, and 3. Prevent the formation of a hematoma. Summary: healing a wound is a partnership between the body and the surgeon. Dressings are the interface with the wound. The goal is a moist, non-adherent, protective environment. Advanced dressings like amnion and collagen act as biological scaffolds to actively accelerate healing. Bandages are the support structure used to hold dressings in place, or, critically, to apply compression to prevent hematoma and obliterate dead space. From the drain in the depth of the wound to the final bandage on the surface, every layer of the surgical closure is deliberately chosen to create the optimal environment for rapid, uncomplicated healing. You've been listening to OMFS Essentials. As always, keep mastering the essentials.